The Chief Scientific Advisor, Sir Patrick Vallance, and the Chief Medical Officer for England, Professor Chris Whitty, have both been challenged by MPs about the evidence behind the latest lockdown in England. In particular, they were asked about some modelling scenarios which had suggested there could be as many as 4,000 deaths a day without appropriate measures in place. One MP accused them of frightening a lot of people. But Sir Patrick said it was based on an assumption to try to get a reasonable worst-case scenario. Our science editor David Shuckman has more details.
It's the risk of the health service being overwhelmed that suddenly changed government policy. A decision based on scientific projections for how many thousands the virus might kill in the coming months. But looking at this official graph, what are the real chances of the worst scenario being right?
As the Chief Scientific Advisor to
That's the question that MPs raised today, putting the government's top advisors on the spot.
You don't think that you just frighten people who do not have your scientific background and understanding of models and not...
Well, I hope not. I mean, I hope not, and that's certainly not the aim. It's very difficult to project forward in a way that doesn't inevitably lead to a problem of, is that real? No, it's not real. It's a model, but it is what we need to understand, because this is a disease which is spreading, like all epidemics, in a way that will affect us in weeks to come, but isn't felt today.
Some of the projections for future deaths were made before the regional three-tier system had any effect. And like any computer models, they're meant to be a guide to what might happen rather than a firm prediction. So is there a clear sense of the impact of the virus? Today we got the latest figures for what are called excess deaths. That's deaths above average, shown on this line here, based on data over the last 5 years. Back in April, losses were massively above that average line, and nearly all of them were because of COVID-19. And looking more recently, there are signs of another increase in deaths above average, and the main cause is COVID. The number of hospital admissions is the key indicator of what's happening right now. And whatever the arguments over future scenarios, there's a warning that things are mostly going the wrong way.
The rates are still steadily tracking up in all the data that I have seen in the older age groups, who are the ones who are likely to translate into hospitalisations, ICU cases and deaths.
The reality is that, on average, someone who's infected is spreading the virus to more than one other person. And the hope is that the new restrictions will help to reverse that. David Shuckman, BBC News.
Everyone who lives or works in Liverpool will be offered a rapid coronavirus test, whether they have symptoms or not, from Friday. Military personnel will help to deliver the pilot scheme, and if it's successful, it could be rolled out across the United Kingdom. Our health correspondent Dominic Hughes reports from Liverpool.
But what did the wars do to people's faith?
Like so many others across the country, pupils at St Margaret's Academy in Liverpool are making up for time lost during the first lockdown.
The imagery tends to be a little bit more positive here.
The threat to their education from the coronavirus remains, especially from those who are asymptomatic, who don't yet have symptoms, but can still infect others.
It's hard for people to come out of work, out of school. We've been affected so badly already.
But what do these sixth formers think about the plan for citywide testing?
You've got to factor in all the people that don't want to get tested, because you can't force people to get tested.
People aren't being safe, especially in Liverpool. There's been a few cases where people just aren't sticking to isolation rules and stuff. So I think I can see it from that point of view why they want to do that.
People do live in fear about the coronavirus, and so it would settle a lot of people's minds if they knew a definite yes or no whether you've got it.
It's an opportunity to drive down the R rate.
The school's principal is Stephen Brierley.
I think if we've got good, accurate knowledge of who's got it and who hasn't, our schools will be safer because there'll be less asymptomatic people in school. There'll be fewer people who are infected, fewer people in schools who are infected, and therefore more children staying in school, more learning going on.
The Liverpool pilot will start this week. As well as existing swab tests, there will be what are known as lateral flow tests, which can provide a result within an hour without the need to use a lab. Organising citywide testing will be a logistical challenge. The Army will once again help, as it did during the first wave of the pandemic. The head of the Test and Trace programme in England, which has been criticised for having only a marginal impact on reducing infections, says this will be a team effort.
This is a programme led by Liverpool, for Liverpool. We together want to find as many people who have the disease as possible so that we can stop them infecting others, and that's the way we will all get back to work and get back to the lives we want to live.
Even a citywide testing programme won't be enough to stop COVID in its tracks. The basics, washing our hands, wearing a face covering, maintaining social distance, remain the best way to stop the spread of the virus. And there are big questions about how many people are going to want to self-isolate if they're not showing any symptoms, and how many will be willing to come forward for a test if it potentially means missing out on work and the pay that will bring.
Anytime you see fire in the church, you've got to think.
In a city that has seen some of the highest number of COVID cases in the UK, the big question is whether more testing will help slow or even reverse the spread of the virus and help keep places like St Margaret's free from infection. Dominic Hughes, BBC News, Liverpool.